Everyone in these late hours of today, and I feel fortunate and thanks Dr. Bharti Kashyap for including me in the instruction course. So trifocal IOL implantation, unilateral cataract dilemma. So whatever I'll be talking, I have no personal reference preference to any person or product, no financial disclosure to make, and purely my personal opinion backed by literature and personal experiences. So the 55 to 65 years old, if there is a survey, the 84% of the people are using a smartphone, 70% own a computer, and 57% use a tablet on a regular basis. So it is a Herculean task, very difficult to argue and convince the people what to do in case of unilateral cataract. Now, the various presentation of unilateral cataract is associated cataract in congenital syndrome, secondary cataract, traumatic cataract, most common use of in young individuals, and posterior subcapsular cataract, pediatric cataract, idiopathic cataracts. So the unilateral cataract, the causative factors we look into it it is asymmetric aging, glaucoma or uveitis, rate of progression of may be different in prolonged exposure of ultraviolet radiation from sun, smoking, or the corticosteroid, diabetes, trauma. Usually younger patients more adaptable in case of these unilateral cataract operations, and more than 50 years of age, second eye to be done at an earliest. So these are the various presentations of unilateral cataracts. So everybody wants a spectacle independence. Now everybody thinks of how to get rid of the spectacles, and there is a common belief that the patients always ask, yeah, after cataract surgery, should I have to use the specs? So there are the evaluation of visions. There are beautiful studies in the literature I found. The unilateral implantation of trifocal IOL is very well tolerated with good patient satisfaction assessed by visual function. This is a study of 2023, and the questionnaire is subject have very cataract in one eye, encouraging single eye surgical procedure in this particular group of patients. So there is one more study as a meta-analysis, and the meta-analysis of 13 unique clinical studies demonstrated that at least 9 out of 10 patients receiving trifocal IOL during cataract surgery can expect to achieve complete spectacle independence. So the congenital cataracts, their exclusions should be associated with glaucoma, retinal pathologies, systemic problems, and trifocal IOL implantation should be considered as an alternative to monofocal lenses in selected patients of cases of pediatric cataract, while amblyopia is not expected in case of pediatric cases. So there is a beautiful study in the literature I found. This is a 2020 of MITRA study of American Journal of Ophthalmology, pediatric unilateral cataract. It says that in careful selected pediatric patients with traumatic cataract, trifocal toric intraocular lenses may offer some benefits over the standard monofocal lenses. There is one more studies, there is a visual performance with monofocal, accommodating, and multifocal intraocular lenses in patients with unilateral cataracts. So these are the different lenses which I am using, there is a group of 87 patients of age group of 40 to 70 years of age. The multifocal IOS provides better stereopsis, higher spectacles independence rates, and satisfactory functional vision over a broad range of distance in presbyopic patients with unilateral cataract compared with the monofocal and accommodative IOLs. The group 3 and group 4, there is higher satisfaction in 92% cases and higher spectacle independence, better stereopsis. So the idiopathic unilateral cataract, the post-cataract surgery unilateral cataract trifocality is always a problem. That the possibilities of the other eye refractive bearer but will be happy with progressive or the bifocal glasses. If the patient becomes motivated for the other eye surgeries, the choice of IOL should be always trifocal. So there is the blend of ADOF with trifocal now. The technologies has come into the market. There you can see the 3 picks in this Tri-plus ADOF high balanced contract in comparison to traditional trifocal. The MTF peaks are almost equal in different foci. So the ADOF trifocal has already launched. The asymmetrical stereopsis is there in the market for at least 1 year or so. The asymmetric stretching of the super Gaussian profile, you can see the Gaussian profiles here. There is no actually the optimized contrast and clarity in different light conditions should be tailored to wearer visual needs, and undulation on the surface reduces the halo and glare drastically compared to the traditional trifocals. So the light distributions in case of the mesopic, photopic and scotopic conditions, you can see the result of fine tuning because the Gaussian surface, then minimal losses and optical light distributions. The hybrid IOL technology has also in this in the field, it is always been launched, and there is ADOF IOL being incorporated to the multifocal technology, and it is there is with the technology that corrects chromatic aberration to optimize contrast vision, and this is people independent design. So the continuous vision across the range empowers patient to see at their ideal distances. IOL with combined ADOF and multifocal technologies delivers in the zone continuous vision from 33 centimeters to distances. So I must conclude. So there is a high myopic patients gone for unilateral cataract. The conclusion: operating the other eye at earliest if possible. Patients wanting for refractive lens exchange, light adjustable lenses, the spiral lens. The Galaxy has already come into market to minimize the dysphotopsia. Unilateral implantation of trifocal IOL in patients with unilateral cataract could provide a good distance, intermediate and near vision with good patient satisfaction.
Thank you.
So we had the best skill, best technology, best setup, best machine, best option of IOL, high expectation of the patients, but why to compromise?